So, artificial intelligence is making a huge move into a really critical part of our lives, our healthcare. These days, AI systems are actually listening in on your conversations with your doctor and then automatically writing up the clinical notes. And that, of course, raises a pretty massive question.
Right. How do we even know if these AI scribes are doing a good job? Are they getting things right? Are they actually helpful? Or are they maybe missing those subtle but absolutely crucial details that could impact your care? This is so much more than just a tech problem. Getting this right is essential for safe and effective medicine.
And that really gets us to the core challenge here. Because figuring out how to grade an AI's doctor's note, it's surprisingly tricky. This isn't like a math test where there's just one right answer. Medicine is complex, it's filled with nuance, and it's incredibly subjective.
So you're basically stuck in this classic dilemma. On one hand, you could have human experts, actual doctors, read every single note. That gets you super high quality feedback, for sure. But it is incredibly slow, it's expensive, and different doctors might grade things differently. Then there's the other option, automated tools. They're lightning fast, they can scale up, but they often just completely miss the clinical nuance. They can't tell the difference between a minor style choice and a really critical mistake.
This is where some new research comes in with a really clever idea. What if, instead of us guessing what makes a good note, we build a test from the answers of the experts themselves? What if we just let the clinicians tell us exactly what matters most?
And this is really the big idea right here. Researchers came up with a way to systematically take all that raw, real feedback from doctors and distill it down into a structured checklist. The whole goal is to create a grading rubric that isn't based on some abstract theory, but is grounded in the real, day-to-day needs of the people who actually have to use these notes.
And listen, they didn't just do this with a handful of comments. This method is built on a massive, de-identified data set of feedback from over 21,000 real-world clinical encounters. That kind of scale, well, that's what gives this whole approach its power and its relevance. Okay, so how in the world do you take thousands of messy, free-form comments and turn them into a clean, effective tool for evaluation? Well, it turns out it's a really careful process of refining and boiling things down. The process itself breaks down into this pretty neat four-step pipeline. First, obviously, they gathered all that feedback. Then, they used a large language model to create a first draft of questions based on those comments. Now, the third step is absolutely crucial, refinement. They merged all the duplicates, they clarified anything that was vague, and finally, they selected the very best set of questions, the ones that covered the widest range of topics without being repetitive. All right, now for the showdown. With this new, powerful checklist built from real user feedback, the researchers put it head-to-head with a baseline checklist. This was one that a powerful AI just generated from scratch, with no user feedback to guide it at all. So, which one was going to be the better judge of quality?
Well, the results are pretty darn clear right from the get-go. The checklist built from feedback beat the baseline in every single category. It had better coverage, which just means it addressed more of the issues doctors actually said they cared about. It had higher diversity, so it wasn't just asking the same question over and over in different ways. And, this is a cool one, it was more LM enforceable, which is just a fancy way of saying the questions were so clear that another AI could use the checklist to grade notes reliably. In every way, it was simply a smarter test.
But this is where it gets really interesting. The researchers ran a stress test. They took good notes and deliberately broke them, introduced errors. And as you can see here, the feedback-based checklist was more than twice as good at spotting these errors. This is a huge deal for patient safety. It means this new method is way more sensitive to those small mistakes or omissions that could have really serious consequences later on.
But honestly, this is the most important test of all. Does a high score on the checklist actually mean the doctors like the note more? Well, for the feedback checklist, the answer was a huge yes. Its scores lined up significantly with what human clinical experts preferred. The baseline checklist, though, its scores had no meaningful connection at all. This is the ultimate proof. The new method isn't just better on paper, it's creating results that doctors actually find more valuable in their work.
And that final point, that is what really elevates this from just an interesting study into a genuine blueprint for building trustworthy AI, especially in any field where the stakes are this high. It's a model for how we can move beyond just abstract metrics and start building evaluations that are grounded in real human needs and expertise. So, what are the big takeaways here? First, we've got a new way to grade AI in these really important fields.
one that's built on real-world knowledge, not just abstract rules. Second, this gives us a scalable and reliable way to make sure AI is not just powerful, but genuinely helpful and safe. And finally, this is a model for building AI that actually listens and adapts to the very people it's supposed to be helping. It all leads to this final, fascinating question. Now that we have a blueprint for teaching AI by listening to expert feedback, where do we take it next? Law? Engineering? Aviation safety? What is the next critical job that we can teach an AI to do right, simply by paying attention to the people who already do it best?